Sierra was a very bright, motivated, energetic, AP classes, good student, loving daughter, sister. I didn't realize that she was even using anything. It started, I think, I don't know, about maybe 17 or 18, and I just, attributed her behavioral change and, the roller coaster and the up and down that every teenage girl goes through to, hormones and so forth, and that was not the case. She started with painkillers and winded up using heroin. Like that just changed her, and overdosed at the age of 22.
We see it all across the country. It's everywhere you could possibly go. There's no discrimination here, so to speak. No economic background, no race, one race. It's anybody. It could be in the inner city, it could be in the suburban towns. No matter what economic background you are or you live in, it can grab a hold of you and just take you.
It's pervasive in Virginia. It's to the point where I think it's affecting everybody in Virginia in one way, shape, or form. If not them individually, their family or friends, co-workers, and to some degree all of us, because we interact with people who likely have an addiction and may not even know it. We're at the point where it really crosses all socioeconomic strata. It in no way, shape, or form picks or chooses any individual group.
Opioid epidemic in Prince William County, as you know, mirrors what we're seeing on a bigger scale nationally. We've gone from having just synthetic heroin to an epidemic of opioid pills. And now with the pill mills being shut down in our community, we're again seeing the synthetic heroin making a resurgence. So we're seeing it cut across a wide swath of population. This is a disease that does not discriminate.
I wish I knew then what I know now, and I may have been more of a savior, a help to my child, because I didn't know where to turn, what to do, and completely not educated or aware of the signs or anything. So I truly think, had I been more aware, educated, the signs, realized that those dangers are in your medicine cabinet, they are at your neighbor's house, they are everywhere, I think my family situation would have turned out differently.
We have to go into the colleges and universities and train medical students, going into the pharmacies, having prescription drug awareness conferences for the pharmacists. It's important that we train and educate, even in the school systems, because this is that much of a problem. DEA's gone to what is called Operation Prevention, which is a STEM-based educational toolkit for schools, parents, and students.
One of the key preventions is to keep people from dying, just so that they have a chance to ultimately get into a treatment program. So that kind of prevention includes things like making sure that Narcan, the reversal drug, is available. And part of the reason that I issued the emergency declaration was to also introduce a standing order so that anybody could get Narcan at any pharmacy as a way to help assure that the Narcan was more available. So that's one form of prevention, but there are others. Some of them include trying to assure that we screen people to find addiction early and then direct them into treatment. The real prevention that we also need to do, which is a critical community piece, is what we call primary prevention. Let's keep people from getting addicted in the first place. And part of that right now is focused on what physicians are doing in their prescribing patterns. The other critical piece of addiction, though, is something I think we all have to, of prevention, is something we all have to look at. And it's how do we help build resilient children in resilient communities who can resist the temptations of addiction, and how do we decrease the drugs in our communities and decrease the possibilities that children, particularly and young adults, will go that route in the first place. But that's a harder, longer-term approach to prevention. Quite frankly, we need to do all of that.
Recognizing that this illness first does not occur in a vacuum, and second, it's a disease of pain. I say it's a disease of both emotional and physical pain. Our programs take into account, therefore, the whole person in treatment. And we start by first helping them get educated about their illness, and moving on, if they are willing and able, to participating in both medication-assisted treatment and psychological counseling. We are trying to make inroads with our schools, with our faith communities, with our treatment providers. We certainly have an ongoing relationship with the Prince William County Police Force and the Sheriff's Office. So we're trying to get it out to as many stakeholders as possible.
It was Oxycontin or oxycodone is what she started with, and over the years that she was using, that became very, very costly. And how she found heroin, I don't know.
You have the synthetic opioids, which are 50 times more potent than heroin itself. And the synthetics are a lot cheaper. They're going anywhere from 3,000 to 6,000 a kilogram, where a kilogram of heroin could cost you 30 to 35,000. And so when you have that synthetic opioid, which 2 milligrams of that substance can kill you, that's a huge problem.
The data over the last 2 years indicates that we've had several dozens, almost in the 3 figures, the number of deaths that we've had in our community. But what's even more challenging, I'm finding out, is the secondary disability that is being caused by these drugs. And that disability is both physical and mental. We don't talk much about the nerve damage, the muscle damage, the tissue damage that can occur when somebody passes out from overdose of these drugs.
I would just probably pass on, something that I wish I would have done was to pay attention to what she was doing. I never checked her phone. I never went on her Facebook. I never looked. And that's where most of her connections and talking about it and getting things, had I think I'd been paying attention to her and in that aspect, I would have, regardless if I wanted to believe it or not, it was right there in front of me, and I would have been able to intervene and help her sooner.
Recently, there were a few different groups put together to try to assure that all the state resources were coordinated, particularly to help localities who are coming together, like here in Prince William, to try to deal with the issue on the ground. And I think the state's critical role is to support what really needs to happen at the local level.
This is a disease of secrecy and shame. It perpetuates when people think they're the only ones suffering. So please reach out. You can ask for myself, you can ask for our substance abuse team, and we get those calls daily, so our staff are well trained to direct those. And if it's beyond the scope of what we can offer, well, we have partner agencies, hospitals, detox programs that we work with. We'll try to network with them and try to get you the help that you need. But first things first, call us, seek that help. There's help available.
It took everything. We're never the same. We're never going to be the same. You know, something's missing that you're never going to get back. You know, just not as a mother, but, you know, she has a brother and lots of cousins and aunts and uncles and grandparents. And, you know, none of us are the same. And none of us will ever be the same. Our lives will never be whole. There's a part of you that's empty, and it's always going to be empty. And nothing will ever fill it, you know. No parent should bury their child, especially for something as foolish as drugs.